When we suspect heart failure, there are several key investigations, and nurses play a vital role in each. First, BNP or NT-proBNP are hormones that rise when the heart is stretched. Levels are usually elevated in heart failure. These tests help distinguish heart failure from other causes of shortness of breath. The nurse explains why the test is needed, ensures the blood sample is collected and labeled correctly, monitors the patient's symptoms while results are pending, reports high values to the team, and helps the patient understand the results in simple language. A chest X-ray may show an enlarged heart, pulmonary edema with hazy, bat-wing opacities, vascular congestion, and sometimes pleural effusions. The nurse prepares and positions the patient, removes metal objects, confirms identity, checks breathing before and after the X-ray, and watches for any worsening respiratory status. The echocardiogram is the most important test. In HFrIF, the ejection fraction is below 40%, while in HFpEF, the EF is normal, but filling is impaired. Echo can also show wall motion problems, valve disease, or chamber enlargement. The nurse assists with positioning, often left side-lying, monitors for fatigue afterward, and communicates urgent reported findings. An ECG is not diagnostic on its own, but may show arrhythmias such as atrial fibrillation, old MI changes, left ventricular hypertrophy, or bundle branch blocks. Routine blood tests may show low sodium, elevated creatinine and BUN, and raised liver enzymes. Thyroid function is also checked. The nurse draws and handles specimens safely, monitors trends in electrolytes, especially sodium and potassium, watches for signs of kidney problems, reports abnormal values that affect medication safety, and educates the patient on hydration, diet, and adherence to medications. Cardiac MRI gives detailed images of chamber size, function, and scarring, helping diagnose myocarditis or cardiomyopathy. The nurse screens for metal implants or claustrophobia, reassures the patient, explains the procedure, encourages them to stay still, and monitors for anxiety or discomfort. Finally, stress testing assesses whether ischemia contributes to heart failure. We may see reduced exercise tolerance or ECG/imaging changes indicating poor blood flow. The nurse checks baseline vital signs, closely monitors ECG, blood pressure, and symptoms during the test, stops the test, and alerts the provider if concerning symptoms arise, and reassesses vital signs during recovery.